July is Sarcoma Awareness Month, so joining us this morning is Dr. John Charlson and his patient Megan to help educate our viewers on early diagnosis and how to find a treatment center. So thank you both so much for joining us. First, let's get to exactly what the symptoms are for synovial sarcoma and what exactly it is.
Sarcomas in general arise from soft tissues like muscle or fat or others, or from bone. And symptoms can be, a lump that's you can feel that's enlarging, or a pain that you can't really explain and it's persisting longer than it should, like a month or longer. Those are kind of red flags that we might want to be thinking about a sarcoma.
Okay, and so how does this impact the daily lives of your patients?
I'll let Megan speak to that. But
Yeah, when it comes to prior diagnosis time, you really, in my case, I was going through a lot of issues with pain management in my shoulder. I had no idea what it was. It was really impacting my ability to sleep, to do normal young person things like go to a concert or play sports with my friends. Even post diagnosis, you are now suddenly launched into this world of chemotherapy and radiation and physical therapy. And that is so different than what a normal 21-year-old is doing, right?
Definitely. Well, I hope you're doing well. It seems like you are so far, but what was the challenge? What did you face after getting that diagnosis, I guess I should say? Like, how did that impact your life, and what did you do from then on?
Yeah, so once I was diagnosed, I had to take a semester off of school. I was in the middle of getting my undergrad degree, and within weeks of that, was, having a port placed in my chest so that I could go through chemotherapy in the next couple of weeks. So I quickly started chemotherapy, followed by radiation, and then a pretty big shoulder surgery, removing that tumor. So it took about a year of my life to, rid my body of this cancer, and then slowly start to figure out how I get back to that, quote unquote normal level.
Right. Wow, that's intense. So talk about then, doctor, the importance of early diagnosis for this particular cancer.
Yeah, for sure. And so, thanks for highlighting sarcoma awareness. But we know that the chances of curing the cancer, so it's gone for good, are higher with the cancer being diagnosed at earlier stages. And so the earlier, the better. Um, and so that it's important that people, like, Megan had this pain that didn't make sense and wouldn't go away, and she got it checked out and got the diagnosis and the treatment. And that's kind of the important message here.
Yeah, you want to listen to your body and not ignore those signs. And you also say that it's important to find physicians who specialize in this, right?
Yeah, so there are better outcomes associated with treatment at a sarcoma center, so a place where the surgeons and the oncologists have experience treating that. These are specialized surgeries often, and the chemotherapy and radiation protocols are different from other cancers. So it's best if you're treated at a center with experience with them.
So then what types of questions should folks be asking once they're there?
As far as treatment goes, what it is, why your doctor is choosing to do that treatment method. I would, do some of your own research, make sure that, that is the right treatment plan for you. And if you don't feel like it is, that's an opportunity to ask those questions or get a second opinion. Once you are going through a treatment, your body is going to go through a lot. You're going to experience a lot of different side effects, as I'm sure we're all familiar. Chemotherapy and radiation can be really hard on anybody, but trying to understand how you can minimize those side effects and use your care team as a tool to help with that process is super important. And once you're through, figuring out how does the rest of your life look post sarcoma treatment? What long-term side effects should you be preparing for? How do you get back into normal adult life? What does that look like with your healthcare plan? So those are all really important.
But optimistic though, right? You're optimistic about your future and now that that's out of here, right?
Yeah, personally, I had a really great treatment course. I am now 5 years cancer free, so I get to celebrate that now.
Yes, well, congratulations. I'm so glad that you are. And doctor, thank you so much for joining us as well to put some insight on this and bring awareness. Where can we go for more information though?
So a couple of websites, there's a number of them, but one, the Sarcoma Foundation of America has a good website called curesarcoma.org. Specifically for synovial sarcoma, there's a website called flagsynovialsarcoma.com.
All right, wonderful. Again, thank you both so much for joining us today. Glad you're doing well, Megan. And everyone at home, if you'd like to see this interview again, you can head to First Coast News Plus.